presentation, and while she's doing that, I'll give you a little bit of background information. My name is Debbie Sizemore, and in my real job, I am the Community Health Coordinator for the state of West Virginia. I'm contracted by the West Virginia Bureau for Public Health, and that's my real job. I only have one real job, and I have about 82 volunteer jobs, just like the rest of you all. For 12 years, I was an EMT with the Williamsburg Volunteer Rescue Squad. I've been involved with CERT, I've been involved with Citizen Corps, I've been involved with National Reserve Corps. I deliver food bank groceries to elderly and shut-ins. I mean, you know, you name it, I think I've probably done it in rural West Virginia. What I'm here to do today is to instill hope in every one of you, particularly the new people who are new to CERT, that if we can set up a rural response team where I am, you can set it up anywhere in this state. And I do mean anywhere in this state. We had quite an issue, and our response team, we call ourselves the WARTS, and we do that on purpose. And once you hear this presentation, you'll understand why, because there's a lot of down and dirty with the stuff that we do. But anyway, we formed in 2003, and in 2003 we had never heard of a CERT team, we had never heard of an MRC, we had never heard of anything like that. And I'm going to go into the presentation. We'll go on a little bit more. If you see in our name, we are the Williamsburg Area Emergency Response Team. We cover the communities of Williamsburg, Trout, Friars Hill, Sunlight, and Cornstalk. I'll just stand here and do it. We're in Greenbrier County. I'm coming to that. People think I come from Virginia to work, and they'll say, why in the world are we having somebody from Virginia actually coming and doing a West Virginia CERT conference? I'm not from Virginia, I'm from West Virginia. Y'all have never heard of Williamsburg, West Virginia, so I say I'm from Greenbrier County, and that pretty well covers it. People are very familiar either with the State Fair, the West Virginia School of Osteopathic Medicine, the Greenbrier Hotel, or the Greenbrier Classic. I mean, that's pretty much where we are. I will leave this up for a minute in case you want to get my contact information. I go around the state and do this training, and you may want it and you may not. Probably not, we'll see. I apologize for blocking the view of the people right here. Okay, so what are WARTS? WARTS are an interdisciplinary group. We are made up of the Williamsburg Volunteer Rescue Squad, the Williamsburg Volunteer Fire Department, the Williamsburg Community Action, and the Northern Greenbrier Health Clinic. We are located in Greenbrier County, and we formed in 2004. I told you we'd get there. The town of Williamsburg is in the geographic center of Greenbrier County. And in 1929, when we actually had a bank, we have a plaque there on the bank that says Geographic Center of Greenbrier County. My community is very, very small and very, very poor. Very small and very poor. We have 414 people in our entire district of Williamsburg, Trout, Cornstalk, Friars Hill, and Sunlight. 414 people. We cover, with our fire and EMS, 77,649 3/4 acres. That includes mountains, that includes 10 miles of I-64, that includes a lot of rural areas that have one-lane roads. We are really, really rural and really, really poor. We have about 20 people per square mile. There's where Greenbrier County is. For people who don't know, I'll step out of the way. We're right down here in southern West Virginia. We border Virginia, but again, I am not from Virginia. People make that mistake all the time. Okay, I wanted to tell you a little bit about our community, because like I said, if we can do this where I am, you can do this where you are. We only have 4 businesses in our community. We have a shade tree mechanic, we have a primary care center, we have a trash company, and we have a post office. That's all we have. We don't have a Walmart, we don't have anything like that. We don't have a department store, we don't even have a mom and pop. If you want to get a gallon of milk or a loaf of bread or put gas in your car, you have to go at least 15 or 20 minutes at least in order to do that. We don't have any school in our community anymore either. Our high school closed in 1962. My grandparents went there, my dad went there. I was fortunate enough to go to the junior high. It closed in 1992, and our elementary school closed in 2007. We don't even have a school there anymore. When we did have a school, 3/4 of the people who attended that school had either free or reduced lunch. So again, when we talk about socioeconomic status, we talk about poverty, we have it where I am. Only 52 people in the entire district have college degrees. Most of the people who work travel outside of our community to do it. As I told you before, there's no business, there's no industry, there's no way to work in my community unless you work in those 4 businesses that I just talked about. So you would go to Lewisburg, Whitesaufer, or somewhere other than Williamsburg to work. You would travel about 30 to 45 minutes to do that. There's only one 2-lane highway, and people laugh at this. There's only one 2-lane highway going into and out of Williamsburg. Most of our roads are 1 lane that you have to get off in order to pass. You have to get off on the berm to do that. Some of our roads are even unpaved. Our nearest hospital is GREENBRIER Valley Medical Center. That is 35 to 40 minutes away from us, and if you're somewhere like in the northern part of the district, Friarsville, Trout, somewhere like that, it takes even longer to get there. Most of our area is comprised of senior citizens, and they live on fixed incomes, by and large. Okay, so why did we decide we needed to develop a community response team? Who has some idea about what happened in our community that we would need to, and not you people from Greenbrier County, you've heard this before. Why do you think we would need to develop an emergency response team in some little place like that, who obviously we're not a terrorist target or anything like that? Anybody?
Disasters happen everywhere.
Disasters happen everywhere, and one specific disaster happened to us, and it was flooding. I'm going to tell you a little story here, and I'm going to try not to be offensive. We are not on the river. The Greenbrier River runs through Greenbrier County. We are not on the river. We're not near Alderson. We're probably 22 to 24 miles from Alderson. We're not near Williamsburg. You know, we could go up through Rennick and kind of access the river there, but we're not a river community. So you wouldn't expect Williamsburg to flood. You just wouldn't expect that. But on November 19th, 2003, we flooded. There are 6 ways out of Williamsburg. 5 of them were blocked by high water on November 19th, 2003. We, at that time, had no plan. We just really did not have a plan. So the power goes out. And people do in West Virginia what people typically do. I'm an EMT, and they're calling my house, and they're saying, Debbie, do you have power? We don't have power up here in Trout. Debbie, the water's coming up. Debbie, the water's in my house. And they're not just calling me, they're calling all the other firefighters and EMTs in the community. And they're saying, what are we going to do? We're going to need to evacuate. We got to get out of here. I have to have a breathing treatment in an hour and a half. We don't have any electricity. What are we going to do? Well, I was just as clueless as the next person, I'll tell you straight up. So we dropped the tones, and all the fire and EMS people went to our station to try to figure out what we were going to do. Our station had no power, so I called our local EMA agency. This is not Paula, and this is not Al. This is the predecessor to Paula and Al. And so we have a wonderful relationship with our local EMA, and I'm in no way making disparaging remarks. But I called and I said, you know what? 5 of the 6 ways out of Williamsburg are blocked. We are getting to be totally landlocked here. We have people who are trapped in homes. We have people who need breathing treatment. What are we going to do? What are we going to do? What are we going to do? Because I knew that the EMA had a county plan. And I knew that I could just call down there and say, what are we supposed to do? And they were going to tell me. Man, was I ever wrong. I said, what is the plan for Williamsburg? And the person in charge at that time said, go to Greenbrier East and shelter. Greenbrier East is next to the hospital, 40 minutes away. We are landlocked. We have no way to go to the hospital and shelter. I said, did you hear what I said? We are landlocked. We have one way out. The water is coming quickly into that bridge, the only way that we have out. We can't go to Greenbrier East and shelter. We are landlocked. What are we to do? Again, the response was, go to Greenbrier East and shelter. I said it to him the 3rd time. And he gave me the same response. And I said, I won't tell you what I said. I hung the phone up, and I was really, really aggravated. And I thought, you know what? This will never happen to us again. As soon as we get through this crisis, we are going to develop a plan, and we will be self-sufficient, and we will do this ourselves. So this is the plan. My son called me. I have to tell you this before we move on. My son called me. He was in high school at the time, and he said, Mom, buses can't run. What's going on up there? I said, well, we're landlocked. He said, can you come to Frankfurt and get me? I said, yeah. So I went to Frankfurt and I got him. That's 9 miles. We're 9 miles from everybody. It's kind of like, you know, George Clooney, Oh Brother, Where Art Thou? You know, where that place is 2 weeks from everywhere. Well, we're 9 miles from everywhere. We're 9 miles from Raiders Valley. We're 9 miles from Alta. We're 9 miles from Frankfurt. We're just 9 miles from everywhere. But anyway, I went to Frankfort and I picked him up, and we were coming back through the bridge, and then the water started into the Culberson Creek Bridge to the point that it was now blocked. So, as I'm going to Frankfort to get my son, to get him home, we have a crew at the station, and they said, people are going to show up here, we've got to be able to feed these people. Now realize we have no power, we have no generator, we have no food on hand, we don't know what we're going to feed them. So we have a crew, we send a crew, an EMT and a driver to Outlet, which is 9 miles in the other direction, to get bread and sandwich stuff and so forth, so that we would be able to feed anybody who actually showed up. So this is what it looked like for us. I'm going to move out of the way so you can see the pictures. This is what TYREE Road looks like normally. This is my brother's house. There is a creek right here. It goes under here. It's not deep enough to swim in. You can wade in it, but you can't swim in it. It's not that deep. That's what it looks like normally. That's what it looks like flooded. So everybody who was up TYREE Road is what? Landlocked. This is actually taken on the lot of our community building where we have our shelter. If I were standing on the parking lot, I would take a picture this way. This is the HEDRICK farm. This is what it looks like normally. That's what it looks like flooded. Okay, now I have to give a little disclaimer here. This is the 4-way in TROUT. If you come here and you go left-handed, you're in TROUT. TROUT at one time had the 2nd smallest post office in the United States. Other than that, you've probably never heard of TROUT and never will again. But you could go over the mountain to Richwood if you kept going this way. This, if you go straight, would lead you to Friars Hill. Friars Hill is also one of the other areas that we cover. If you go this way, you go into Sunlight. That's one of the areas that we cover. These, and I'm pointing them out for a reason, are Edwin McClung's cattle. This is the 4-way in TROUT. The closest creek to here is probably a mile or so away. That's what it looks like normally. That's what it looks like flooded. This is not a cow. And I say this in all seriousness because I had somebody come to me and attack me after a presentation one time. How in the world would you show dead cattle carcasses? I can't believe that you would do that. How insensitive are you? I can't believe that is not a cow. That is a rock. But anyway, this woman was deeply offended, and so I want to point that out, that no, that is not a cow. No animals were harmed in the production of this video. So, anyway, as you can see here, you can't get to TROUT, you can't get through to Friars Hill, and you can't get to Sunlight. You just can't, because you don't know what's under all that debris. Okay, this is Pembroke. This is a road that will take you from TROUT to Williamsburg. Here's a bridge. On this creek, actually it's called Roaring Creek. Yeah, that was a cow. I brought that along specifically for Saturday. Copperheads will actually sunbathe on the rocks in Roaring Creek. There's never any water in Roaring Creek. So anyway, my aunt lives right here in this place that you can't see. That's actually her mailbox. That's what it looks like normally. That's what it looks like flooded. I really thought we were going to lose the bridge. So needless to say, you can't even use Pembroke to get from TROUT to Williamsburg or vice versa. If you go through this bridge and look left into the field, you would see my Aunt Mary's house. My Aunt Mary was one of the people who was trapped in her house and needed a boat in order to be evacuated. So, did we have a boat? Did we have a plan? Did we know what we were going to do? Nope, we did not. Not then, anyway. I told y'all we had a 2-lane highway. Right there it is. This is the only 2-lane road that we have coming in and out of Williamsburg. This is just water in the ditch. This is not a creek, but there is a creek over here that you can't see. That's what it looks like normally. That's what it looks like flooded. And no, I am not the fool who's in that ambulance trying to... This is the crew who actually went to Alta to get the bread and the food and the stuff to bring back. When they drove through, going that way, the water was in the road, but you could drive through it, and I know we're never, ever, ever supposed to drive through water. It's more than 1 inch deep. It was not that deep when they went through, but they're coming back and they have supplies. Thank the Lord they had the stuff up on the bench seat and stuff, because otherwise we would have had soggy food and really have defeated the purpose. Probably 3 seconds after this was taken, the ambulance itself started to float and had to be winched out. So, and I wish you could see the panic-stricken look on the EMT's face right here, but you can't. Okay, so how did we do it? I told you we were determined we were not going to be caught with our pants down again. Flat out, we will not be in this situation again. So I'm going to go through these pretty quickly right now, and then I'll go through them one at a time. We determined the participants. Who is it that we're going to need to set up a response team? And then we developed a memorandum of understanding. And then we surveyed our community, compiled databases, secured resources, and then told the community, this is what we're going to do. We also called down and told the EMA, this is what we're going to do. We're not counting on you anymore. When it hits the fan the next time, this is what we're doing. Not can we, will we, you think it'd be all right? This is what we're doing right here. This is what we're doing. Okay, so determining the participants. You need to ask yourself, who is it that we're going to need if it hits the fan again? Well, for us, it was pretty simple. Who did we need? Who did we use before? Who is needed to carry out a disaster plan? And for us, we decided we needed the fire department. That's clearly, they were the people who were trying to get up there with the boat to evacuate people. And then after Hurricane Katrina, we decided we also needed a fire department for security of the shelter. So we used the fire department. As I said before, we don't have any infrastructure. We don't have a McDonald's who will bring food to volunteers. We don't have funeral homes who can, supply us with body bags. We don't have any of that kind of stuff. So we have to use what we have in town. Rescue squad. If we can't get out because we're landlocked and all the ways out of town are blocked, then somebody's going to need to be able to treat anybody who's hurt or injured or whatever in the disaster. Community action. Our community action has a community building that's literally attached to our firehouse, and you can step literally from the doorway of one into the doorway of the other. So it's pretty good that we have a good working relationship with them as well as attached buildings. So community action, that's where we're going to use our shelter. And then the food pantry. I told you guys we had no food. There's a food pantry that's actually given out the third Saturday of every month. And so we developed an agreement with the food pantry such that if it hits the fan again, we're going to use your food, we'll keep track of it, and then we'll pay you for the food that we use. Turns out during the derecho, they had given the food out the week before, so the food we were planning on, nope, did not happen. Clinic. Northern Greenbrier Health Clinic is literally next door. It's not as far from here to the Holiday Inn, away from the community building and firehouse. So we would use the clinic for additional healthcare needs. Okay, so this memorandum of understanding. We really wanted to formalize the roles. We wanted to say, this is what we want you to do, fire department, this is what we want you to do, rescue squad, so forth and so on. We wanted them to know this is how you become a member of our organization, this is how you leave if you no longer want to be a member. We have call-down lists, and I'm going to talk in a minute about our response and the derecho and all that kind of thing. But call-down lists are really, really important. We need to know who the chief is and who the captain is at the rescue squad, and who the CEO is at the clinic, and so forth and so on. We made sure that our memorandum of understanding was signed by a duly elected representative. It's all good and well if your fire department buys in and really wants to participate in your disaster plan, but if you don't have the buy-in of the chief or the powers that be, you really haven't gotten anywhere. So we wanted to make absolutely sure that we had leadership buy-in as well. We talked about how the plan was going to be, if we were going to have any drills, how it was going to be drilled, how it was going to be modified, how it was going to be updated. People get a little bit confused here when I say we surveyed our community. What we did is we developed a neon orange one-page survey that we sent to every single person in our district. It was a one-page survey. And the reason we were able to have the addresses of all these people is because the fire department and the rescue squad send out, I'll call them donor campaign letters. I call them bum letters, frankly, every year just to say, this is how many calls we've run this past year. We're looking to buy a new piece of equipment. Can you give us some donations? Can you give us some support? And so we have a database full of the names and addresses of the people in our area. So we got together, we copied them, the school did the copies, the clinic paid the postage, we all got together, we folded them, literally it was a trifold, stapled them, slapped address labels on them, and mailed them out. Just wanted to survey everybody in our community. And we asked them, is there anybody in your house with special needs? Do you have anybody at home on a vent? Do you have anybody on home oxygen? Do you have anybody who's bedbound? Do you have anybody in a wheelchair? Do you have anybody who's deaf? And we went through a whole thing. We wanted to know who they were, where they were, what their needs were. We also asked them, in the event of another emergency, would you be willing to volunteer with us? And people would send in their responses and say yes or no. We asked them specifically, do you have special skills? You would be amazed at the number of people. We have, I think, 84 volunteers. Now remember, we are an area of 5 communities with 414 people. We have 84 active volunteers. And we have people, we have a physician, we have a mid-level practitioner, we have 3 or 4 nurses, we have a pharmacist, we have ham radio operators, we have sign language interpreters, we have retired electricians, we have heavy equipment operators, we have people with counseling and social work and those kinds of background, we have people willing to do childcare, we have cooks. I mean, when we sent out this survey, that was the kind of thing we were looking for. We need volunteers and we need to know what you can do. So, once we got these responses back, we compiled these databases. And we know who in our community. I can tell you who's in a wheelchair within 3 miles of our shelter. I can tell you who is on oxygen. I can tell you who would need to have backup power immediately because they're on NEP treatments, and so forth and so forth and so on. Because we did that survey, we sent it out, and we got it back. This next part just deals with the worried well. As I told you in the beginning, we have a lot of senior citizens, and a lot of those people actually just want to call to check in. They're not going to be the people who come in for shelter. That's not going to happen. We have always said at the WARTS, we will be sheltering people who are not our own. We will be, because our people just are not going to do that. They are not going to come because they have kin, they have family, they just are not going to do that. They're self-sufficient, they're rural, they're up a holler, they're poor, they're just not going to do that. So, but we know that some of these people just want to have a call. You know, hey, Miss Smith, this is Debbie, I'm with the rescue squad. Are you doing all right? Do you have power? Do you have food? Is everything okay? It's just that kind of thing. Okay, so I told you we have a list, we have a database of volunteers, we have a database of people with special needs, we have a database of equipment. Like that boat that I needed at TROUT, we didn't have a boat at that time. I can tell you now how many boats we have and where they are, so that if we need to move a boat to TROUT to get somebody out, we'll know where the closest one is. So, and you're going to laugh at this one too. After you receive responses, after you do your community survey and you get these responses back, you need to write a thank you note. And you need to discuss, dear Mrs. Smith, thank you so much for agreeing to be a volunteer with WARTS. We understand that you are a sign language interpreter and you can donate 2 chainsaws in the event of an emergency again. But the most important thing that you need to understand is you need to put a statement in there that not every single volunteer will be activated every single time. And I say that on purpose because in my community, there are so few of us. And if you tick somebody off, well, you contacted Mary Jones and you didn't contact me, and I've been one of them wards ever since y'all started, and I'm just not happy about this. So you can just take my name off the list. Do you understand? I am not happy. I am just as good as Mary Jones. It's that kind of thing that you get. This is small town West Virginia, and this is the way it is. So in your thank you note, and we put it in bold letters, you need to say, not everybody's going to be activated every single time. It will depend on where the disaster is, what kind of skills we need, and so forth and so on. And we say that as gently and with as much love as we possibly can. And then also you need to say, we plan to drill or we plan to do an exercise or whatever. We have found in my community that tabletop exercises are just ridiculous. People will not come out for them. If you do a full-scale drill, you know, where people actually have roles and whatever, that works much better. At that time, when we first started with WARTS, we met every year in June. Some years we would drill, some years we wouldn't. Some years they wouldn't know whether we were going to drill or not. But anyway, drills are a great way that we have been able to keep people engaged. Okay, so getting resources. This is what Gina particularly wanted me to talk about because it's very hard. When you have no infrastructure, you have lots of poverty and so forth, how are you going to get what it is that you need to staff your shelter? So the first thing we thought we needed was space. Where are you going to house people? If you're going to do a shelter, where are you going to put them? And we decided we were going to put them in the community building. We also have the gym that's literally within sight, the old school, where we can put 400 more people. But as I told you, we only have 414 people in our entire district, so it's not likely that we're going to have overflow from the community building up to the gym. Utilities. Now this is another good one. This goes to this lady's question about generators. If you have no electricity, and in Williamsburg there are a lot of times we don't have electricity. I always say if the sun goes behind the cloud and stays too long, then we're going to lose electricity in Williamsburg, because that's just the way it happens to go. But if you don't have electricity, how are you going to provide heat? How are you going to provide lights? How are you going to cook? We decided that what we were going to do was we were going to get a generator, and we were going to be able to run the community building and the firehouse. Now remember, these two are adjacent, they're actually connected. We're going to run both buildings full scale, full power. So I told you guys we have a retired electrician in there as a WART member, and he went around, he plugged up everything we ever thought about having. He turned on the showers, he turned on the water in the kitchens, he turned on the microwaves, he turned on all the computer to see how much power was going to be pulled if every single thing was on. Because his point was, and it was a good point, if we're in a disaster response, we're going to be using all of this stuff. People are going to be taking showers, people are going to be cooking, people are going to be, so we really need to power everything up. So he came back to me and he said, Debbie, we need a generator that costs $22,700. I thought I was going to fall on the floor. You might as well have said it's going to cost us $250,000, because that's how we just don't have that kind of money in Williamsburg. We just don't. Well, some people do, but they're not going to part with it for a generator, So anyway, we decided we were going to start fundraising. So we did bean dinners, and we did quilt raffles, and we did womanless weddings, and we sold raffle tickets, and we wrote grants, because all of our partners, with the exception of WARTS, are a 501c3. And so we would actually write grants, and we got a small, like $3,000 grant, and then we had one guy who thinks he's a politico in our county, and he went to the governor and said, you really need to support these people, and we got $5,000 from the governor's emergency contingency fund, and so, but the rest of it was fundraised. I mean, and it was literally, bean suppers and stuff like that, plays and all that kind of stuff, because that's just the way we had to do it. One of the things you need to think about with the generator is, in terms of fuel, we learned this during the direction, and I'll talk about it in a minute. If you need fuel, how are you going to get it? Who's going to deliver it? If you're landlocked, what are you going to do? We've done some things different since then. Food and water, again, how are you going to get it? Where are you going to get it? All that kind of stuff if you don't have it. How much are you going to keep on hand? What are you going to do to keep the bacteria from building up in the water? How long are you able to store the water? Things like that. These are all things that you need to consider. What else are you going to need? Cots, blankets, medical supplies, and comfort kits. I have a really funny story to tell about this. We have a wonderful WART volunteer named Andy Legg. He is with the National Guard. He was based out of Fairmont at that time. He was in a medical unit based out of Fairmont. And the National Guard was actually getting rid of a bunch of medical supplies. And he came to me and he said, Debbie, we have the opportunity to get cots and IV poles and 4x4s and 2x2s and IV start kits and all this kind of stuff, because the government is going to get rid of them. If I can get permission from the government, there's that cow again. If I can get permission from the government to donate this to the wards, would the wards be willing to accept it? I said, absolutely, we will. And he said, well, you're going to have to come up there and haul it down. So we got low boys, and we actually went to Fairmont after he received the permission, and we got all these medical supplies, and we were absolutely tickled to death, because we had no way to do any of this without that. Well, we'll talk in a minute about these cots that we got, because they really weren't the best. But anyway, comfort kits, we thought, well, how are we going to provide comfort kits? And what we did, we used the CEOs. Those are the old home demonstration clubs, community education outreach people. That's a civic group in our community. And we took a washcloth, and they actually sewed pockets into the washcloth, and they stuffed in these hotel-size shampoo, hotel-size toothpaste, toothbrush and comb. So, and then we rolled them up and put a ribbon on them. We went to the Wurtons and we said, we need stuff for little kids to do when they come to the shelter. So the Wurtons bought teddy bears, and they bought coloring books, and they bought crayons. This is the way that we have to get things done. This is the way that we in rural West Virginia get resources. We don't write a big federal grant. This is what we do. Can you give us a couple $100 for coloring books? So anyway, that's what we did. Now, we thought we had this covered. After you set up your emergency response plan, it does absolutely positively no good if your community doesn't know about it. So for the first few years after we set up the wards, we would actually, at all community fairs, at the bear dinner, at the ramp dinner, any kind of function that we had, we would put up a display about the warts. Now, if you want to volunteer, you do this, and in the event of a disaster, you just show up at the community building, and we will handle this. You just show up at the community building. And we put things in the newspaper, and we did things on the TV, and we really, really, really thought we had this covered. Boy, were we wrong. Now, if you had seen this presentation before, it would have stopped right here after this. But then the derecho hit. Now, you have to realize that we formed in 2003. We did not have a response until last year. It was 8 years before we ever put our plan into effect. It's very, very hard to keep people interested, to keep people engaged, to find new volunteers, to expect people to remember what happened. It was 8 years. I mean, we did drills and we had meetings and so forth, but it was 8 years before we ever tested our plan. And by then, either people had forgotten about us or new people had moved into town and they didn't know about us, and so we did not inform the community as well as we thought we had. So, the storm hits. You guys all, I'm assuming, are from West Virginia. We heard that all these counties that are represented, so you know about the derecho. I'll tell you straight up, I had never heard of the term derecho until last year. Never heard of it. Didn't know what it was. It's a straight line windstorm for those of y'all who were not affected. I can't believe that there's anybody in the room who wasn't, but anyway, that's what it was. A tree actually fell on my house. I had one tree in my yard. It fell on my house on Friday night. On Saturday morning, I get a call from our EMA and from Al actually, and he said, can you set up a shelter? He said, it's going to be bad. We're looking at 10 days to 14 days without power, and can you set up a shelter out there? I said, yes, we can. Now, you have to think, we look like a war zone. Our roads are blocked, again, this time by trees and debris, and we had barns that, were blown over, and we had roofs that collapsed, and it was just a nightmare. So he called us at 10:30 and he said, can you set up a shelter? And I said, yep, we'll go, we're on it. So 5 of us went. We had no phones. We always anticipated losing power, but we never anticipated losing landline phones. We thought we might lose cell. We never thought we would ever lose landline phones, and we lost landline phones. So literally, I was driving to every WARTS house that I could to say, can you come to the community building? They want us to set up a shelter. And so 5 of us showed up at 11 o'clock. That first night, we sheltered 14 people. They were all special, with the exception of their staff. They were all special needs. We had one woman who was incontinent, non-ambulatory. She was brought to us by the Fairleigh Ambulance Service. We had one guy who was on a CPAP and needed the power. We had 8 people who were either mentally retarded or developmentally delayed with special needs, 3 of whom had DNR. DNR, for those of you who don't know, are do not resuscitate cards. I made a mistake one time when I was an EMT. I went in and I asked this lady if her husband had a DNR. She said, oh no, he never worked for the Department of Natural Resources. So I had learned not to use acronyms, and so anyway, 3 of them had DNR cards, and I was really, it was very interesting to be able to shelter in our first time out all these special needs people. It was quite a challenge, but we did it, and we did it very well. This one guy was a screamer, one guy was a runner, one guy was blind. It's just not to be believed. I told you guys that we have a pharmacist, and the pharmacist actually comes down and does the meds because we are not allowed to dispense, and so we have to call him, and he comes down, he dispenses, then we lock them up. But fortunately, these people were all from a group home, and they brought their own nurse with them. She dispensed their meds, and then she left, and then she came back the next morning to do that again. So anyway, our first shelter operation was quite the event. We were not quite 24 hours into it, and I had been up 46 hours, and I went home. I live approximately a half a mile maybe from the shelter, and literally I hadn't been in the bed 15 minutes, and I get a call from Jared Gum, and he said, Debbie, the generator is smoking. I said, shut that thing down. And he said, we're afraid if we shut it down, we won't get it back. I said, shut that thing down. We cannot have the community building and the firehouse burned down. And we didn't know at that point whether or not we would ever be able to get it to come back up. But, fortunately it did. So we didn't have problems with food because what happened in the derecho was people's freezers were melting, and so they were donating it. I mean, we had sides of beef, and we had turkeys, and we had ham, and we do a rent dinner every year in Williamsburg, and there were leftover hams from May We just had the ramp dinner, and Lori Hedrick came down. She's a WART volunteer. She said, "You have to use these hams now. They're starting to thaw." And so, I mean, we were eating. We're going to talk in a minute about what we were eating. But anyway, we started this feeding program because the longer it went, you know, the more people who were actually out of food and their food was destroyed and so forth. So I told you guys that the feeding program happened because of the people in the community. We had turkey and dressing and mashed potatoes and French toast and bacon and eggs and salt. You know, it was not MREs. It was not this ready. It was, this is what we had because and we literally fed people from a lot of times 6 o'clock in the morning until after midnight because we have people who work in the coal mines. They work night shift. We have people who are nurses at the hospital, so they would need to go in on a night shift. So we kept food back for all those people and literally ran a feeding program. During the worst of the crisis, we were feeding between 200 and 250 people a day. Now, for us, that's half of the people in our catchment area. And we never made people feel bad about coming in. I would just unobtrusively sit by and count because I knew we were going to have to give a report to FEMA about what we were doing and what our expenses were. But we never, you know, asked anybody to donate anything. People did donate money afterward. Who's doing this? How are you guys able to do this? And people would donate money, but I would just kind of sit in the corner and count the number of people who came through. MREs came to us for the first time on day 5, and the Red Cross actually started delivering to us on day 6. And I am not in any way slighting the Red Cross because I told Paul and I told Al, I said, we got it covered up here, send the food somewhere else. We don't need it, we're fine, just give it to people who really need it. One of the biggest concerns that we had involved feeding the Department of Highways, feeding the National Guard, and feeding the people from the utility companies who were trying to work to get the lights back on. My brother works for the Department of Highways. Now, this storm hit on Friday night about 9 o'clock, and on Sunday he came to me and he said, "Debbie, we have people going hungry in the Department of Highways. They expect us to get out here in 100-degree temperatures and work." And they're, when we said to the big boss, "What are we supposed to eat? How are we supposed to get water?" He's like, "Well, that's your problem." And that just kind of flew all over me because these are the people who are really trying to get us back on our feet, and that's your problem. Now, you have to realize this was at the end of the month. A lot of people were out of money at the end of the month. That's just the way it is. And so, in our case, the stores in Greenbrier County weren't open until Monday. You could get gas on Sunday night at Kroger, which is, again, 45 minutes from our community, but we didn't have, and even if you could get to the store, all of the things had been pulled off the shelves because they had gone bad because the power was out. So we have people out there who are working to restore services who don't have anything to eat. So a lot of the time what we would do is my brother would call me, and then I got to be the most well-connected person in Greenbrier County because then I had different crews from Department of Highways all over everywhere calling and saying, "Hey, could we get 14 lunches out here? We're at Sam Black or we're at, wherever." And we would take it to them because we thought, we have the food, they need the food, and they're working to help us out, so we need to do that. Another thing we did was we actually took meals to elderly and shut-ins because, number one, we wanted to make sure that they were eating because they, again, are not the kind who are going to come in for shelter, and we wanted to make sure that they were actually getting something to eat. This is just a picture of the stuff that people kept bringing, and they kept bringing, and they kept bringing. These are just some of the pictures of the feeding program. On the first Sunday morning, and I say this because we were without power 14 days. Parts of our area got it back a little sooner, 13 days, the night of the 12th, but we were without power by and large, and we actually kept it up and running until every single person in our area was back up and online. This is a church service the first Sunday. We were just all over it, it was something else. So, we fed 1,687 people in those 14 days. We fed about 141 meals a day, and we delivered meals to elderly and shut-ins. We had more than 3,080 volunteer hours logged, an average of 28 people volunteered a day, but we had 59 different volunteers come in and help us out. We had 42 people who showered at the firehouse every day. It was very hard, and a lot of times people would call after we got phone service back to reserve their spot in line because, I have to be at work at 11 o'clock or whatever. Can I come in at 9:30 or what? And we tried to accommodate that. But people were so thankful for a shower. It's just not to be believed. And in addition to the water for human consumption, the fire department hauled probably tens of thousands of gallons of water. We're a big farming community, and we have a lot of dairy cattle, a lot of beef cattle in our area, and so the fire department was literally hauling this water out to the farms. Some of the lessons that we learned, and I hope that you guys can learn from this as well, don't rely on landline phones. We had thought the cells would go down. We never thought the landlines would go down, and they went down. Cell phones don't work in our community building. They do now because we bought a booster after the fact so that we can actually stand up. Because what was happening is I was going, and Paula's smiling at this because it's really true, she'd call me on the interop radio and I couldn't hear her because I was in the building. So I'd walk halfway down the parking lot. I say, okay, Paula, I'm sorry, I didn't, so fire and EMS is coming to get me saying, Debbie, you need to go talk to her. And so, that was what we had to do. But now it's better because we have that booster. I told you I was going to talk about these cots. It turns out the cots that we had were actually litters. You guys know what a military litter is? It's a canvas piece, it's this long, handles on this end, and you carry somebody with it off the battlefield. Well, these litters actually had stands, so that's why we thought we had cots, because we had these litters, but they were on a stand. So we thought, well, people could come and sleep on this. Wrong. No, our cots were not adequate. Our cots were 2 inches off of the floor. So the EMA, I called Paula and I said, Paula, these cots just are not adequate. We're going to need something else because we have these people in shelter and whatever. And so she brought up the interop radio, and she brought up 14 cots that night because well, actually more than 14, but we only used 14 because it was just not to be believed. So really check your cots out before you actually use them for the first time, because we thought, well, we'll just stand them on these stands and everybody will be good. No, the stands collapsed. It was a mess. So anyway. Water is very important. Like I said, we had food to feed people, but the first few days we didn't have water, and the people from the EMA were actually getting us water, every time that we needed it. And then once the water delivery started, they never ever stopped. And so we're really thankful for that. Don't think that people will remember what they're supposed to do. Even people who've been with you since the beginning will not necessarily remember. We had told our community, I told you guys, we blanketed it, we talked about it everywhere, every time the first few years, and people did not show. One woman showed up at the community building cussing the people behind the counter. Why didn't you tell me that you were down here? And it was a good long cussing for a good long while. And so finally I just put my arm around her and I said, let's go outside and talk for a minute. And so it all worked out, but don't expect that people are going to remember what they're supposed to do. Number one, it's a very stressful situation, and number two, people tend to forget things. Debriefings are really, really important. Every night I would send a text message after we got cell service, because sometimes we'd lose cell, sometimes we'd have cell, sometimes it was just a nightmare. So every night I would send our local EMA a briefing just saying, we fed 142 people today, our water's holding out well, we're down to a quarter of a tank in terms of fuel, we may need a fuel delivery tomorrow, whatever. Not to bug them, not to get in their head, just give them an update. This is what it is, this is where we are, this is what we're doing in our community. And I can't stress this enough either. You really need to have a sense of humor, because by the 14th day, a lot of people hadn't showered, a lot of people were tense, a lot of people couldn't work. It was a nightmare, and everybody was on everybody else's nerves. So a sense of humor is really, really important. This is actually somebody giving somebody a haircut. This is a Red Cross volunteer. This is Tommy Cannon, one of our paramedics, actually doing a haircut. Whatever you can do to relieve the tension, that's what you need to do. Two of the most important things we learned is it pays to plan. Our plan, and as my dad would say, don't break your arm patting yourself on the back, but our plan worked. We had never tried it, we had never tested it, and it worked. And we had it in place, and there were glitches, there were problems, absolutely, but it worked. So our first lesson was, it pays to plan, and we are really fortunate to live where we live, because I don't know if we didn't have the community that we have, we've been able to pull this off or not. So, from now on, when you think about warts, I hope that you think it's more than just an ugly blemish on your skin. That's the reason that I titled this session what I titled it. So I'm happy to take your questions or comments or. Yes, sir.
What was wrong with your generator?
I don't. The question was, what was wrong with your generator when the black smoke was coming out? I think it was probably too hot. They actually shut it off. They left it off for 30 minutes. They turned it back on, because what happened initially is it went into brownout, or this is what they tell me, I wasn't there, I had just gone home, and it went into brownout, and then it starts to smoke, and I said, turn it off, we can't risk burning down 2 buildings, and so they turned it off, And they said, it's gonna be okay, just turn it back on in a half hour. We turned it back on in a half hour, and it was fine. But I don't know, that happened early on, and we didn't have any more problems with it after that. Yes, sir.
Debbie, can we get copies of your slides, please?
Yeah, I actually thought about doing handouts, and actually Gina will do that. If you need me to come and speak, I'm happy to come and do that if you think that that would be helpful to you where you are. The reason that I have done this all around the state, because I think if we can do it, and I said this at the beginning, if we can do it where I am, you can do it where you are, because there are lots of obstacles, and you can do it where we, but I'm happy to provide the slides, or actually, Gina, can you make that happen? Yeah. I was going to do handouts, but the handouts are 8 pages long, and so that's why I did not do handouts. Yes, sir.
Russ, could you just print it to a PDF file and email it out?
Yeah,
PDF file and email it out? Yeah.
Good.
And we'll post it on our website.
Good.
We'll post the link.
This lady, Fran, is saying that the MOU may be helpful for some people to see as well. That is actually not included. I mean, I'd be glad to share that with you, but you know, I have no problem sharing that. I think that this is the best way. You know, this is why I came to this conference, was because I want to get ideas to take back to see what we can do to improve, because, you know, we can always learn from each other. And yes, ma'am.
How often do you have to update your databases?
The question was, how often do we update our databases? Actually, I just did a big update. We meet quarterly now. We've applied for our 501c3, we being the WARTS. We did that actually 1 year ago today, on November 1st. When we had our WART meeting in September, I called the IRS to say, where are we in process? Because, you know, I'm the person who wrote the bylaws and all that stuff for the Citizen Corps in Greenbrier County, and it doesn't take this long. And she said, we're just now working on April of 2012, so you're going to be a while. With all the things that are going on Capitol Hill, I guess that's why it's going to take a while. So when we had the derecho, we had a lot of spontaneous volunteers show up, and I did a big update then. As somebody joins, we actually, I keep the database, and that's one thing I failed to say. All of our, if it were to hit the fan while I'm down here in Charleston today, there's a book, a large notebook, that has the call down list, because we don't count on computers. We can't go on and electronically access. So we have everybody's name, everybody's phone number, all of these resources, the boats, everything that I talked about. The rescue squad has a big copy of this notebook. The fire department has a big copy of this notebook. The clinic has a big copy of this notebook, so that my copy is at my house. If my mother, who's a WART volunteer, needs to go to my house and get the, so she can start calling down volunteers, she has it, she knows where it is. But if somebody from the fire department or somebody else is the person to actually activate the response, then they know, and they have all the information that I have as well. Yes?
How did you guys handle lack of power with regard to sewage? Or what was your sewage treatment plan for the community?
We all have wells. And we, you know, people would come to the firehouse, they would haul water, they would take it home, they would dump it in the back of their toilet, they would flush their commode, and, you know, just into their septic. It would, you know, we're not on a public service district or anything like that.
We had, in my hometown in southeast Missouri, when we had an ice storm, actually it happened with a tornado and an ice storm 2 different times. When you have a loss of power and you can't get your sewage pump station to move the product,
Right.
you know, you very quickly find out how bad you need those facilities.
Right.
Yeah.
Yeah. Yes, ma'am.
What is a womanless wedding?
I always say that. I always try to explain, because people look at me and they say, a womanless wedding. Actually, we started doing a womanless wedding in Williamsburg back in the 50s, and I have pictures of my grandfather in a womanless wedding. A womanless wedding is actually a play that's put on, and all of the parts are played by men. So you would have a man in a bridal gown, you would have a man in bridesmaid's dress. It's just men in drag. I mean, literally, it's what it comes down to. But men play the male parts as far as the groom and whatever, the ushers, and then men play the brides and the bridesmaids and the flower girl.
Lots of West Virginia jokes right here. Just saying.
Yes, ma'am.
How much, or if any, funding can you get through your county commissions and things like that? I know years ago when I was in the EMT volunteer squad, the county commission helped fund some of our activities and our resources.
Actually, we, the wards, have never approached the county commission. Right after the derecho, Al asked me to come in and do a presentation for the county commission, because he thought that the response that we put down was a good response, so we actually came in and did a mini version of this PowerPoint and just kind of said, this is what we're doing, not do we have your permission or can you support us or whatever, but this is what we're doing. Because we learned that lesson early on that if each community can plan for itself and self-sustain, you know, all the literature tells us 72 hours is what you need to be a minimum of self-sufficient. And so we thought we'll be self-sufficient until the cows come home because, you know, of that bad experience that we had. But we have never approached them, so that's probably a good idea. Other questions or comments people have?